Welcome to the National Academy for State Health Policy's 33rd Annual Conference, State Health Policy, Flexibility, and Resiliency through COVID-19 and Beyond. These are unprecedented times, and we are so happy that you, over 1,000 members of the state health policy community from every state, have chosen to be here with us. On behalf of NASHB's Academy members, leadership, and staff, we are humbled by the flexibility and resiliency displayed by this group as this global pandemic has challenged us in ways we've never dreamed of. Over the past 6 months, and it seems like years, doesn't it? State leaders have risen to the challenge. We've become procurement experts, tracking down PPE and testing supplies, finding places for homeless individuals to quarantine, working with nursing homes to stem the horrific surges of disease there, setting up our own home offices, and for many of us, hoping the kids would actually do their online schoolwork for at least the duration of a Zoom meeting. Public health folks worked nonstop, often with imperfect information, to deliver messages many did not want to hear. In Ohio, protesters picketed the home of the public health director, and across the country, politics polarized the response to this public health crisis. State leaders like you were on the front lines and somehow managed each day to do your jobs for the people of your state. We have been challenged to rapidly find solutions to new problems, and we've done it. For me, a longtime Medicaid director, I was prepared to do what was needed to get folks covered quickly. I knew from that first Saturday morning when my phone rang, awakened me from a deep sleep, and hearing the voice of the Seattle-King County Public Health Director telling me that their first COVID-positive patient had been identified at a nursing home in Kirkland, and that our lives would be dramatically changed. We'd no longer be dealing with day-to-day issues of coverage, financing, and benefits, but instead trying to figure out what 1135 waivers and state plan amendments we needed to craft and quickly get to CMS, how to procure adequate PPE, and what PPE was necessary for places like nursing homes and for home care workers, fielding concerns from the provider community, and how we would be maintaining the viability of the provider community when folks were even afraid to go to the doctor and elective surgeries were placed on hold. We continued serving our communities by helping set up isolation and quarantine facilities, helping practices pivot into the new world, quickly expanding telehealth so providers could stay in touch with their members, and rapidly redeploying a workforce who would now work from home for the foreseeable future. This is just to name a few. As you know, we are in this for the long haul, and we know the issues will continue. Who will pay for testing? Which tests are reliable? The continued saga of adequate PPE. When an effective vaccine is ready, and how will that be distributed and paid for? And does the behavioral health system have capacity to address the increased anxiety and depression that many are feeling? And how will we assure the safety net is intact as the economic downturn continues and state revenues fall? We have seen innovative solutions and advancements put into practice at lightning speed. However, the pandemic has also brought to light the exacerbated existing health inequities and the underlying systemic racism causing them, an issue in the forefront of the conference agenda. NASHB's annual conference has always been a safe harbor for states to share experiences, think through problems, and develop creative and effective solutions. Now, more than ever, we need to come together to support each other and think through these tough issues. Although we cannot be together in person, NASHB state leaders have done our best to create a sense of community virtually. This year's event, Delivered to Your Door, was planned by the states for the states. NASHB members are busy state officials who made the time to plan the agenda, coordinate speakers, and organize sessions to address state needs. I thank them and our great NASHB staff for an incredible effort. By now, you know we have even replicated our usual swag bags. One NASHB tradition since our earliest conferences has been the blueberry break, a break in the action to enjoy blueberry treats in recognition of NASHB's roots and our office in Maine, the nation's biggest producer of wild blackberries. Although we're unable to physically be together, we nonetheless will continue with our blueberry break tradition which explains why you found blueberry jam and a slew of recipes in your bags. The venue for this year's conference is new, but our dedication to the work of state health policy and the extraordinary work you are all doing is unchanged. The agenda highlights key issues and opportunities for states, and we are sure you will find the same great information and conversation that marks every NASHB conference. While we were unable to be in Boston today, we're delighted to bring a bit of the state to you and are deeply grateful that Governor Charlie Baker has agreed to kick off the conference. Following his remarks, NASHB Executive Director Trish Riley will lead a conversation with several policy leaders. With that, it is my great honor to introduce Governor Charlie Baker. Massachusetts has been a leader in health policy, establishing a health policy commission designed to limit healthcare cost growth, enacting model health coverage reform, and addressing the opioid epidemic and public health challenges. Governor Baker has held leadership roles throughout, in his service in state government and as the former CEO of the nonprofit Harvard Pilgrim Health Plan prior to winning the governorship. We know that the governor is deeply engaged in the Commonwealth's COVID response, and we are humbled that he has made time in his schedule to welcome us. So it is with great pleasure I give you Massachusetts Governor Charlie Baker.
Hey everybody, Massachusetts Governor Charlie Baker here, and I want to start by welcoming you to this virtual conference. Obviously, we were hoping that you'd be here in Boston to take advantage of all the great sites and the great restaurants and the great things to do we have here in the Commonwealth. But COVID had other plans. So as a result of that, we're doing this virtual, but I'm told we'll get you back in 2023. I go way back with this organization. I used to serve in the administrations of Governors Bill Weld and Paul Cellucci back in the 90s. I was Health and Human Service Secretary and Administration Finance Secretary. And I actually attended some of the National Academy's events back then, and maybe once in a while even had a chance to speak. I leave that these days to people like David Seltz and Luis Gutierrez and Dan Tsai, three terrific players here in the Commonwealth of Massachusetts who represent, I think, the very best of what we bring to the table with respect to healthcare and especially state health policy follow-through and execution. And I just want to say to all of you, this has been a particularly trying time for everybody in state government and everybody in the healthcare space. COVID is like nothing I think any of us have dealt with before, and we were all forced to make a lot of decisions in a very short period of time based on imperfect information and in many cases a scarcity with respect to resources and data and all the rest. And I'm incredibly proud of how many of us over those periods of months managed to find a way to get things done on behalf of the people that we serve and tried to do it in the way that made the most sense for everybody. I think, if anything, COVID has exposed all kinds of opportunities to improve our healthcare system. Certainly the arrival of telehealth here in Massachusetts for all kinds of preventive healthcare and behavioral health services has been a godsend. Some of the rules changes we made with respect to addiction treatment are things that I think should continue as we go forward. And it's obviously laid out for all of us a roadmap with respect to the things we need to do to dramatically improve health disparities and to deal with many of the social determinants of health, especially related to race and geography that came about as a result of the presence of COVID and what it sort of uncovered. The final thing I'll say is how much we appreciate these opportunities to gather. I can just tell you that from my own experience as somebody who's been in the healthcare world and in government and in the private sector for the better part of the past 25 years, gatherings are a great opportunity to learn. They're a great opportunity to hear from other people about a different way of solving a problem or thinking about an issue. And I certainly hope in this virtual world you'll all have a chance to do that. And obviously we all hope and look forward to the fact that at some point we'll be able to do this the old-fashioned way, which would be same place, face-to-face, and maybe even with a handshake or a high five. Thanks very much. Enjoy the conference.